Okay, this is the end of our CNS Farm Part 2. We're going to talk about muscle spasm and spasticity. Here's the objectives. Oh, I don't have any objectives for this one. That's okay. If you have objectives on the other recorded one, they're there. We're just going to talk about muscle spasm, and then we're going to talk a little bit about spasticity and um, just in general some things. So we know some of the causes of muscle spasm are involuntary tightening or contraction of the muscle, leading to pain. There's a decreased level of function with this if there's so much contraction and pain. The severity of this is what we use the medications for to control it. The causes can be from muscle injury and trauma. So nurses are at high risk for this because you're lifting and moving patients, and you can get back and shoulder and arm injuries injuries, and that causes muscle spasm. Um, Low calcium, low potassium can cause this. Lack of blood supply, like with claudication, where the muscle's starved, can lead to spasm and pain. So what are we going to do to treat this? We're going to look at the cause. The treatment focuses on the acute injury. So either you're going to have rest or immobilization, and you're going to try and relax the muscles. Cold compresses might be early on to decrease inflammation and decrease transmission of pain signals as well with using ice or cold compresses. Whirlpool can be used to relax tightened up muscles to loosen them up. And then physical therapy might be used to stretch gradually. You're going to use physical therapy to, let's see, passive or active. You're going to this exercise so that you're getting help with relaxing the muscles again. And then you're going to use drugs. So analgesics, including aspirin and ibuprofen, but maybe not aspirin as much as ibuprofen, naproxen, or even some combos if the pain is really severe, like Vicodin or narcotics, to have centrally acting muscle relaxers, that kind of medication. So that's what we're going to talk about first, centrally acting muscle relaxants. The action is kind of unclear. We know that there's depression of the CNS, and the thought is that you're decreasing spinal cord reflexes, and assuming that the CNS depression results in the lack of spasm signals. So centrally acting drugs with this kind of CNS depression are going to cause drowsiness. You're going to have physical dependence. You're going to have to teach them no drinking, no driving, and especially no other sedating drugs. So there's three big things right there about teaching with this muscle relaxants that are act on the CNS. Also, there's going to be, if they're taking Vicodin along with a different kind of muscle relaxant, there's going to be two big safety issues there that you're going to have to talk to patients about to help them, because they're going to be more CNS depressive effects. So cyclobenzaprine or Flexeril is an anticholinergic. So with that one, you know you're going to get the drowsiness, dry mouth, urinary retention, photophobia, so watch out for the sun. Also, with older folks on this one, you got to be careful with these anticholinergic effects, constipation, confusion. So again, we're going to contribute to the relaxation of muscles with some of the CNS depression. Methocarbamol or Robaxin. This is an odd adverse effect of turning the urine dark green or brown. It's not dangerous, it's just odd. And then, of course, there's diazepam, Valium, which we've talked about a bit, the benzodiazepine, which is going to lead to CNS depression, but then will relax muscles. All right, so with spasticity, this is a movement disorder. There's heightened tone, there's abnormal tightness and stiffness, there's loss of dexterity. This one's secondary to other disorders, usually like multiple sclerosis, cerebral palsy, stroke, CVA, spinal cord injury. So anything that where the signal has been impaired, it directly can lead to the spasticity problem. We kind of use two drugs here, centrally acting or direct acting drugs. Baclofen is a centrally acting drug. Let me see if I get over there. Yeah, baclofen or lioresal. It is a centrally acting drug that, of course, will make drowsiness. Let's see. On baclofen, it further depresses the CNS because it's GABA-like. We're not sure how, but you know, GABA is an inhibitor, so we're expecting that depression with it mimicking GABA, the CNS depression. Then you go on to Valium again. This one, CNS acting, so it increases drowsiness. It also works on muscle spasm to suppress the spasticity also. And then dantrolene inhibits the calcium release from the sarcoplasmic reticulum. So this one is a direct acting right on the muscles. It's working at that sarcoplasmic reticulum. It's going to inhibit calcium release. So the muscle is going to be weaker and it's not going to be able to contract. So that is sort of the big adverse effect with this because they're going to be weaker, and you're going to have to assess this for people with dantrolene. They're going to need to be checked to see how they can function if their muscles are so weak from the drug. It's a kind of a safety. Let's see. It doesn't cause drowsiness, but it causes weakness. Let's see. Other uses for dantrolene are malignant hyperthermia, which is a problem that happens sometimes with anesthesia, and is a real big issue for patients in the OR, where they can have bad muscle spasm, and that leads to increased temperature, hyperthermia again, and it needs to be corrected right there in the OR. So this centrally acting baclofen is if it's abruptly stopped, the adverse effect with that is it can induce hallucinations and seizures, which is a bad situation. And then with dantrolene, you got to watch out for liver toxicity. So if I don't have this corrected on your slide, the centrally acting baclofen, if it's abruptly stopped, it may induce hallucinations and seizures. At one point I had something about withdrawal, the word in there, and that wasn't correct. So just want you to know about that. And okay, so we're done talking about muscle spasm, and I just want you all to be aware that there is the discussion board. So put questions up there if there were things that were unclear that you couldn't really hear or understand. I realize I talk a bit fast, and that can be a problem. I know that I wanted to impress upon you a few things. I told you a couple of times when I repeated it and said, make sure you know this. The one thing about dantrolene is that you want to, when patients are on this and in any kind of therapy, because they have spasticity, you want to be able to do an assessment on their muscle strength while they're taking that drug. So I'll look forward to reading your questions on the discussion board and to the Q&A if you come to that as well. Thank you very much.